Hi everyone, welcome to AMC by Minute Med. I'm an international medical graduate and I know firsthand how overwhelming the AMC journey can feel, especially when you're trying to figure everything out on your own. So that's exactly why we created this guide. It's not just about tips, it's a complete breakdown of the exam structure, format, how to prepare, what mistakes to avoid, and the approach to the exam, and all that. So in this video, we'll walk through what the AMC Part 1 exam is and why it matters, the structure and format of the exam, the key topics, skills, and question types you'll face, the best resources to use, the 6-step study strategy that actually worked for me, and pitfalls you'll want to avoid, and a few final tips to make your preparation smoother. So, whether you're just starting or halfway through your prep, this guide will help you focus, stay consistent, and move one step to that Australian medical dream. Let's go. Right. So the AMC examination, it's how international medical graduates are assessed for medical registration in Australia. It's designed to ensure that we meet the same standards as locally trained doctors, both in terms of knowledge and clinical reasoning. So there are two key stages to the AMC examination pathway. The first one is the AMC MCQ exam, which is a computer-based test, and it checks your understanding of core medical knowledge and decision making. The second part is the clinical exam, which is in person and practical. It's focusing on communication, examination skills, and your knowledge on safe practice. So this entire process is overseen by the MBA, which is the Medical Board of Australia. So if you're an IMG and your primary medical degree is not accredited by the AMC and you're not on the competent authority pathway, then passing the AMC exams becomes essential if you want to work in Australia as a doctor, unless you're a specialist, because then you can go through the specialist pathway. Right. Let's move on. So let's break down the standard pathway. So this is undertaken by IMGs who are not on the competent authority pathway. So here's how it works. First, you apply to the AMC and get your primary source verification done through EPIC. And then you sit for the AMC MCQ exam. Once you pass it, you become eligible to apply for limited registration, but only if you secure a job offer. So if you have a job offer after AMC MCQ, you can apply to the MBA for limited registration. And then you work for 12 months. So it should be 12 months supervised practice. So after that, you must also pass the clinical exam after your 12 months of supervised practice, or you can do the workplace-based assessment or the WBA. So you can do either one of those, but the chance of obtaining the opportunity to do a WBA is quite rare, but the pass rates are really high. So that depends on how everything works out for you. So once that's complete, you're eligible to apply for general registration with APRA. Right. So if you're going through this route, you're not alone. Thousands of IMGs take the same journey every year, and it all starts with mastering the MCQ exam. So this pathway can take time, but each step is designed to make sure you're ready for the clinical responsibilities and standards of care expected in Australia. Okay. Now let's talk about the competent authority pathway. So this is a faster alternative for certain IMGs, especially if you passed the medical licensing exams and hold registration in a country considered a competent authority, like the UK, the US, New Zealand, Canada, Ireland. So you may be eligible to bypass the AMC exams entirely. So here's how it works. Once you secure an employment offer in Australia, you apply to the AMC for primary source verification, then apply to the Medical Board of Australia for provisional registration. So in this case, what you'll be getting is provisional registration, not limited registration. Then you complete 12 months of supervised practice. And finally, you can apply for general registration. So in this pathway, you can bypass the AMC exams entirely. You don't have to do any of the AMC exams if you are on the competent authority pathway. So Even if an IMG didn't graduate from a competent authority country, they can still access the competent authority pathway. So one common route is by passing PLAB 1 and 2 and obtaining GMC registration and completing 12 months of supervised practice in the UK. So this experience makes them eligible for limited registration not limited, makes them eligible for provisional registration in Australia under the competent authority pathway. Now, let's talk about the focus of the AMC MCQ exam, because this is where many people go wrong. The exam doesn't just test what you know, it tests how you think as a doctor. So it's not about memorizing facts. You have to understand the concepts, reason through clinical problems, and make safe decisions under pressure. So the exam evaluates basic and applied medical knowledge, clinical reasoning, not rote learning, not memory, understanding of disease processes like your grasp of diagnosis, investigations, and management. So it's based on the level expected of an Australian medical graduate starting an internship. So it's not just textbook knowledge; it's real world frontline thinking. So the AMC uses 4 key graduate outcome domains as the foundation. So firstly, it checks, can you think like a clinician or slash scientist? Then it checks if you can assess, diagnose, and manage safely. Then it checks, do you understand your role in the community? And how do you work within a team, communicate, and how you act ethically? So ethics is a big part of the MC examination process. So these domains shape the questions you'll face, from emergency cases to mental health, ethics, and public health. So your prep needs to be broad, practical, and clinically focused. Right. So let's go over the structure and the format of the AMC MCQ exam so you know exactly what to expect on test day. It's a computer administered exam with 150 multiple choice questions. You will have 3.5 hours to complete it. That's 210 minutes. Around 50% of the questions are from a calibrated pool. These have already been tested and are scored, but the AMC never releases any of those questions. And the rest are new questions which are being trialed for future use. So these don't count towards your score, but they are mixed into the exam. So after the exams, all new questions are reviewed and calibrated to make sure they are fair and they meet the standard expected of an Australian medical graduate. The AMC uses a content blueprint to make sure there's balanced representation across key health domains. For example, medicine makes up 30%, surgery 20%, women's health, child health, mental health, and population health each make up 12.5%. So don't ignore any category. This is very important. Even population health and psychiatry can show up in multiple tricky scenarios. So your preparation should be well-rounded. So this is where the AMC exam gets really interesting, and it's a little different from traditional tests. It's based on computer adaptive testing, or CAT. So this means each candidate gets a unique set of questions, and the test adapts in real time to show how you perform. It doesn't show how you perform, but it adapts in real time to how you perform. And so here's how it works. Your first question is randomly selected. If you answer it correctly, the next one will be slightly harder. So if you get it wrong, the next one becomes a little easier. So this adaptive nature allows the system to pinpoint your competency more efficiently. So two people might both pass the exam, but they'll have answered completely different sets of questions depending on how they perform throughout the test. So it's all about accuracy and not luck. So that's how you get your final result. Now let's take a look at how AMC MCQ is scored. It's not simple. It's not a simple how many correct answers kind of test. But thanks to the CAT format, your score depends on the difficulty of the questions you got right and not just how many. So here's a key point to highlight. Let's just take a hypothetical scenario. There's two candidates. So they can get very different scores even with a similar number of correct answers. For example, candidate A might get 70 out of 150 questions right, but if they were all tough ones or if they were mostly tough ones, they might score 267 and pass the exam because the passing score is 250. Meanwhile, candidate B might get 72 correct, but mostly easier ones and still score below 250. So just a hypothetical scenario on how CAT works, computer adaptive test works. So that's why AMC doesn't disclose the number of correct answers you need. Instead, the goal is to reach a scaled score of 250 out of 500 to pass. So the point is focus on understanding concepts deeply because you're rewarded more for answering challenging questions correctly. The platform itself also has a few important features you should be ready for. So there is no review feature. Once you answer a question, it's locked in. You can't go back. This means you have to commit to every decision. So don't rush, but pace yourself adequately while leaving time to complete the rest of the questions. And the good news, there is no negative marking. So wrong answers won't penalize you. Always make sure to attempt every question though. The timer counts down from 210 minutes, showing how much time you have left. So the questions are randomized and you'll only see one at a time. This format encourages confident, consistent clinical reasoning. So you have to train yourself to stay calm under pressure and build a rhythm for handling each question. So this is a graphical representation of how it could look at the exam day. It doesn't include everything, but this is how the time goes. It's a countdown from 210 minutes. And then when you click next, you go to the next question. So you cannot go back and review your previous questions. Uh, right. So the result and the performance sheet. After your exam, you'll receive a performance sheet that breaks down your score and shows how you did in each domain. So it includes your AMC adaptive score here out of 500 and whether you passed or failed, and a color-coded performance graph like this across the 6 domains, medicine, surgery, women's health, child health, mental health, and population health. So the colors mean, so if it's green, it's satisfactory. If orange, it's borderline. If it's red, it's unsatisfactory. So this breakdown helps you identify weak areas if you need to resit or even if you pass. So even if you fail the exam, you still get your performance sheet. So you can identify your weak areas. It gives you insight into where you might want to focus before your clinical exam or even before entering actual clinical practice in Australia. Let's talk about something that every AMC candidate comes across, recalls, which are reconstructed AMC questions. These are MCQ papers which are circulating online claiming to contain real AMC questions. But let me be clear, use them with caution. These questions are reconstructed from memory, so they're not officially released by the AMC. So that means they might contain incorrect or outdated answers. Some may be poorly worded or even misleading. But so using them blindly can give you a false impression of what the exam is actually like, right? So how do you use recalls wisely? First, don't memorize. Instead, you look for patterns and focus on understanding concepts, not just repeating the answers. You have to cross check every answer with solid resources like therapeutic guidelines or RSEGP, etc., etc. Then you use them as a diagnostic tool to identify your weak areas and guide your revision. And most importantly, don't rely on recalls alone. They should supplement your prep, and but they shouldn't become the core of it, right? So you just use it as a supplement tool. If you treat recalls like practice drills filtered through verified guidelines, they can actually be helpful, but never treat them as your primary resource. Let's take a moment about why having a structured study plan is absolutely essential for the AMC MCQ exam. This isn't just about hard work, as I told you earlier, it's about working smart. So the AMC exam is broad, unpredictable, and designed to test real clinical reasoning. It's not textbook recall. If you don't have a plan, you will waste time jumping between resources, second guessing what to study, and burning out before you even get close to the exam day. So that's why I put together this 6-step study framework to help you stay focused, be efficient, and avoid the mistakes that so many INGs make. Step 1 of the study plan is simple but crucial. Revise your basics, especially if you've been out of clinical practice for a while. So if you're feeling rusty on foundational topics, spend some time reviewing either the first aid, John Murtagh, or a YouTube crash course. Just make sure whatever you do, it's structured and medically accurate. So it's not about deep diving here. You set a time limit and you focus on high yield clinical concepts. You don't memorize anatomy mnemonics here. No, you don't do that. But you just warm up and bring your clinical brain back before tackling AMC style logic. So trust me, it's better to fix the cracks now than struggle later when you're knee deep in MCQs. Step 2 is where real AMC prep begins. read the AMC Handbook of Multiple Choice Questions. So this book is underrated. It was actually published by the AMC itself, and it gives you the structure of how AMC frames its questions, the style of reasoning they expect, and the logic behind the answer choices. However, okay, so this is key. It was published in 2009. So while the question logic remains relevant, management details may be outdated. So that's why you need to cross check with current Australian guidelines like therapeutic guidelines or any official local resource. But I heard that the AMC handbook of MCQs is being phased out and it will soon be replaced by a new app that reflects the actual exam style and topics. So I'm not sure if it's out yet, but candidates will be notified once it's ready so they can prep more effectively. For more information, you can check the AMC website. So when you're going through the handbook, think of this as your training ground. So once you learn how AMC frames clinical problems, you'll be better equipped to tackle any question. Step 3 is to go through the anthology of medical conditions. So I feel this book is essential, even though this book itself is underrated. So it contains over 130 clinical presentations designed to match the way cases are presented in the AMC exams and Aussie hospitals. So why it matters? It trains you to think diagnostically, not just memorize this. Also, the most important part, don't skip the Leo section, which is legal, ethical, organizational issues. So these scenarios are common in the exam and even more relevant in your day-to-day work in Australia. Use this book to strengthen your reasoning. It's not for learning. It is, you can learn a lot, but it's mostly to build that critical clinical thinking part of you. Step 4 is to pick one question bank and stick to it. So this is one mistake I made at the beginning. And a lot of people lose focus here. They just jump between 5 different platforms and you feel even more confused. So you don't need 5 question banks. You need one good one used properly. So personally, I used Amedex and I found it well structured and exam oriented. But choose what works for you. M plus X, Canada Q Bank, UWorld, whatever it is. Just whatever you pick, commit to it. So don't just passively solve questions, review every answer if it's right or wrong. So understand why it's correct and why the others aren't. So that's where the learning happens. So step 5 is about smart support. You add 1 or 2 supplementary tools along the way. So you'll sometimes need to look something up in more detail. That's when resources like therapeutic guidelines, up-to-date, PMJ, best practice, Medscape. So there's a whole list in the AMC MCQ specifications booklet. You can go through that. So you use this to clarify weak areas. You use them to support, not distract from your main prep. So these tools are for targeted reinforcement. It's not your primary study source. So use them to clarify weak spots, right? Step 6, when doing MCQs, always refer to up-to-date Australian clinical guidelines. So this is the golden rule. So that means you go through therapeutic guidelines, RSCGP books, official Australian health protocols. So avoid mixing resources from USMLE, PLAB, or your home country's guidelines because AMC exams are Australia specific. I cannot emphasize more on that. And even if you choose the most logical answer, it could be marked wrong if it's not aligned with local practice. But you can use your USMLE, PLAB, or home country guidelines to revise the basics. But when you're doing questions AMC style, it should be Australia specific. So this one step, consistently cross-checking your answers with Australian guidelines, it can dramatically improve your accuracy and confidence. And finally, don't underestimate the power of group discussions, even if you prefer studying solo. So this was an absolute game changer for me. So why group discussions? Because number 1, explaining concepts out loud boosts your retention. You'll easily spot gaps you didn't realize you had, and the clinical reasoning improves when you're challenged by others. So even small group chats or Telegram group chats, it can be gold. So don't avoid group discussions. Research actually shows that discussion improves long-term memory far better than passive reading, of course. So yes, study alone if you prefer, but make time for discussion. It keeps your brain engaged. You study, your understanding deeper and your prep far more effective. So you don't need to talk or discuss every day, but at least try once or twice a week. You will see the difference then. Before we wrap up, I want to quickly walk you through the official AMC recommended resources that I personally extracted from the AMC MCQ specifications booklet, which is on their website. So these are not random study materials. They are explicitly mentioned by the AMC to guide your preparation. And the best part is that they reflect exactly what Australian clinicians use in real world practice. So let's break down by category so you can build your own personalized toolkit. So, firstly, for general med and clinical knowledge, therapeutic guidelines is highly recommended. It's for official Australian drug and treatment recommendations. For Australian practice guidelines, you can use RSCGP, the Red Book, the Green Book, the National Guide for Indigenous Health. Aboriginal health is also a commonly tested part in the AMC MCQ exam. For pediatrics, Royal Children's Hospital clinical guidelines are very useful. They are clear and concise. So you can take a screenshot or refer to this slide later. For immunization, the Australian Immunization Handbook. For psychiatry, Kaplan's and Sadok's concise textbook of clinical psychiatry, and especially the DSM-5 criteria, very important. For OBS and women's health, the RANSCOG statements and guidelines and pregnancy care guidelines are useful. For ethics, law, and professionalism, you can use the Good Medical Practice and the Ethics and Law by Breen, Corden, and Thompson. All right, now let's run through some of the top AMC prep tips I wish I had known from day one. So number one is stick to a core framework. Don't bounce between 20 resources, just pick a few and go deep. And number two is use Australian guidelines no matter what. Recall says AMC always follows TG, RSCGP, etc. Number three is practice MCQs daily, not just solving. You review the why, not just the what. Number four is nail the high yield topics. You'll notice how certain systems, how certain concepts keep showing up. So you go deep into them because they're high yield and they will be mostly tested, right? Then you simulate the exam, full length, 3.5 hour practice sessions are a must. You will build stamina and the timing. So I highly recommend you to go on YouTube and search 210 minutes timer. There is a video for that, and you put that playing on another device, and you use that as a countdown timer from 210 minutes to 0 minutes, which will help you to simulate the exam conditions. Number six is don't ignore legal, ethical, organizational topics. They are underrated, but they're high yield, very high yield, right? Number seven is be consistent, not perfect. So daily small steps matter more than a once a week session, right? So number eight is discuss and teach. If you can teach it, that means you know it, right? So group chats help retention massively. So these simple habits add up. Keep this checklist somewhere visible. If you're preparing for the exam, it'll really help you. So here's a classic emergency scenario. I just extracted a sample question from the AMC specifications booklet. A 24-year-old woman presents to the ED with a painful swelling on the right side of the neck, worsening over the past 3 days. She's now having noisy breathing, difficulties swallowing, and is feeling sweaty. On examination, she looks in distress with a temperature of 38.2 Celsius, BP 100 over 70, 100 and pulse 110 per minute. She has tender enlarged lymph nodes on the right side of her neck. A view inside her mouth is shown on the photograph. Which one of the following is the most appropriate management? Right. So this is the sentence you have to focus on even before reading all this. If you read this last part first, it will give you an idea into what AMC expects, because the clinical scenario that they give is quite long. And by the time you get towards the end of the question, you might have forgotten what's up there, right? So first you read this, what are they asking from you? And then you read the clinical scenario. So while reading, you try to understand what they are actually asking for. So the options are amoxicillin, incision and drainage, CT head and neck, ultrasound neck, endotracheal intubation. This is a textbook deep neck space infection, likely a peritonsillar abscess, based on the clinical features and the image, right? So what Australian guidelines say, especially the therapeutic guidelines, it says for suspected peritonsillar abscess with systemic signs or airway compromise, urgent incision and drainage is the first line treatment. So that would be the answer here. Because if you delay your drainage, it may lead to airway obstruction or deep neck infection. So antibiotics are required, but it's not first line in the presence of an abscess. So that's how you approach a question. We don't do endotracheal intubation. It's not needed yet because there are no current signs of respiratory failure or airway collapse. But the airway will be monitored carefully post drainage. So in this case, the final answer is incision and drainage. So AMC loves these real world urgent cases. You have to learn to spot the red flags and act fast. Sample question number 2. 50-year-old with a 2 centimeter pigmented lesion growing over 2 months, irregular borders, uh, differences in color. So this is suspicious for melanoma. So according to Australian guidelines, especially the Cancer Council guidelines, any suspicious pigmented lesion, it should be assessed for melanoma, especially when it comes to the ABCDE criteria. If it's asymmetrical, border irregularity, color variation, and if it keeps changing the color, so it should be assessed for melanoma. So the first line and preferred method for diagnosis is complete excisional biopsy, and it will be diagnostical as well as therapeutic. So to answer a question like this, you can refer melanoma guidelines of the Cancer Council of Australia. So let's go over the most common mistakes AMC candidates make and how to avoid them. Number one, collecting too many resources. Stop hoarding Telegram files, right? You have to be strategic. So if you just keep collecting without structured use, you'll be wasting a lot of time. Number two, skipping Australian guidelines. Even if you're even if you're trained in the US or UK, you must switch to Aussie protocols. Number three is cramming instead of understanding. So AMC twists its questions. They could be asking for most appropriate, or the initial management, the best investigation. So if you don't know the reasoning, you'll fall into traps. So the same scenario will be asked in different angles. If you don't understand the why, you'll fall into trouble. So that's why you have to understand the reasoning. Number four is ignoring ethics and law. Don't skip this part about consent, mandatory reporting, duty of care scenarios. They are high yield and they're often neglected. Number five is not practicing exam conditions. So don't just do 20 MCQs lying in bed. Practice the full 150 questions in 3.5 hours. Build your endurance, build your stamina so that you don't get tired doing 150 questions for 3.5 hours, right? And that brings us to the end of this guide. I know preparing for the AMC MCQ can feel overwhelming, but please remember this exam is 100% doable. Thousands of IMGs before you have done it, and so can you. So the key is to study smart, stick to Australian guidelines, and be consistent with your effort. At AMC by Minute Maid, we are here to support you. So drop a comment below if you have any questions. We'll personally go through them and reply. If this video helped you, like, subscribe, and share it with fellow IMGs who need it. And let's make that Australian dream come true together. Thanks for watching. Best and best of luck for your IMC journey. Thank you.